what are the reasons why, general reasons why the transplant patient? These patients either have cirrhosis, um, liver cancer, or acute liver failure, acute and chronic liver failure, you mentioned previously. We determine, where someone is on the list, and we kind of determine how sick someone is based off a score that we call the MELD score, and this stands for Model of End-Stage Liver Disease. Now, this score ranges from 40 being the highest, which is those patients are the sickest, to about 6 being the lowest. And we use this score because this score predicts, depending on where they are on the score, predicts what their chance of dying are at 3 months or 90 days. So when we evaluate a patient for transplant, we have to, the question we ask ourselves, is this patient sick enough to need a transplant, but not too sick where they can't survive a transplant? So what does that mean? We need to determine, hey, do they, we do a medical and a psychosocial evaluation. So that, quote, sickness, the medical sickness we look at, or, do they have any cancers outside their body that would prevent them from being transplanted? Do they have any heart disease, any kidney disease, any lung disease, or anything like that that could make them high risk for transplant or increase their risk of dying just by going through a surgery, major surgery like a transplant? And the other sickness we look at is the psychosocial evaluation. We look at we have our transplant social workers who are really experts in managing, identifying various substance abuse disorders and mental health diseases to kind of evaluate, is there a mental health disease, that aspect to this patient that needs to be treated, or if there's anything that's too high risk for them to undergo a transplant. So like I said here, if we determine they're a candidate, a patient with high MELD or liver cancer, we do a psychosocial and financial evaluation and a medical evaluation to determine if they're safe enough to undergo a transplant.